So we're continuing with Chapter 3, Biological Foundations, Prenatal Development and Birth. You will remember that we talked about the development of the fetus inside the womb. And now we are going to talk a little bit about teratogens. Now, teratogens are any environmental agents causing damage during prenatal period. There could be different influencing factors of how much these teratogens will affect the growing baby. These include dose, heredity factors, other negative influences. So if there are multiple, for example, if there are multiple teratogens that are being used at the same time, this would be included in other negative influences. And age at the time of exposure, this is of the baby. And these are kind of bidirectional. So how much a teratogen affects will also depend on other factors. Now we're going to talk about different types of teratogens. We know that there are different periods of sensitivity in the fetus's development where they might be affected more in one aspect than the other. And this graph from your book, this figure, 3.8, actually nicely demonstrates that. And you will remember when we were talking about Chapter 1, we already talked about one kind of teratogen, and that was the drug thalidomide, right? And we said that if it were taken during a specific, very limited time period, it actually affected the development of the limbs, legs, arms, hands, and even fingers and toes. You do not have to memorize this graph. It's just for illustration purposes. So we have to keep in mind that when we say teratogen, we don't mean only substances that are harmful to the mother. The substance could be good for the mother, but it's not always that way for the developing fetus. These could be prescription drugs. And yes, we talked about thalidomide. DES or Accutane are other examples. It could be non-prescription drugs. So something like aspirin, for example. There have been many studies done on aspirin take during pregnancy. And it actually seems to affect the development of the baby adversely. And so it should be taken with care and under doctor supervision if necessary. But also illegal drugs like cocaine, heroin, and methadone. Other teratogens, again, legal, could be tobacco or alcohol. We're going to talk a little bit more about alcohol, radiation, environmental pollution, and other types of diseases that the mother might experience, such as rubella. And so there are different teratogens, there are different agents that cause harm to the developing fetus. Now, I would like to take a moment of your time to talk a little bit about alcohol, because it's been debated a lot in the past 2 decades as to whether drinking, mild drinking, when I say drinking, I don't mean getting drunk, but mild drinking is actually harmful for the baby. This is basically from the National Organization on Fetal Alcohol Syndrome from the US, and it states, pregnant women who drink do not intentionally harm their unborn babies. In most cases, they simply do not know about FASD or fully understand the risks. They may have been given incorrect information about alcohol and pregnancy from family, friends, or healthcare providers. In some cases, women have a serious problem with alcohol, and they need professional help to stop drinking. Others do not even realize they're pregnant when the drinking occurs. And so this is to say that there's actually something called FASD. This is fetal alcohol spectrum disorders. And there are different types of it, but you don't need to know the types. The spectrum is fine with us. And it basically, the intake of alcohol during pregnancy may affect the development of the fetus that then becomes visible and observable when the children are born. About 10 to 40% of the children of chronic alcoholic women are diagnosed with FASD, and some individuals might be more susceptible to others, meaning not all pregnant women who drink have children that diagnosed with FASD, but it is a high risk factor. So the factors to consider are when we're thinking about whether a child born will be affected or not, the dose of the alcohol intake, how much is the mother drinking, the pattern of exposure, whether it's a chronic drinking or binge drinking. So binge drinking would be getting drunk one night and drinking excessively, but not drinking regularly. Developmental timing of exposure, when is the fetus exposed? Genetic variation of the infant, maternal characteristics, age, health, otherwise. Synergistic reactions with other drugs. Is the mother taking other drugs? And will they interact and cause harm to the developing fetus? And interaction with nutritional variables. What kind of nutritional intake is the mother being exposed to? But the thing is, there is no exact science. Even knowing all of these will not, for example, allow a doctor to predict whether the infant will be born with FASD. So it is a gamble when a woman drinks when they're pregnant. And alcohol exposure in the womb has been linked to differences in brain structure. So the development of the brain is affected, both in size and also in structures like corpus callosum, which has an active role in relaying messages from two hemispheres and is central to healthy cognitive functioning. The problem is most children are diagnosed at school age because they present with learning difficulties. So a child who's born with FASD may go unnoticed until the child starts school. And these could present themselves as verbal and academic impairments, executive functioning impairments. And what is executive functioning? Executive functioning is the ability to regulate attention. It actually involves working memory. It includes regulatory control. It includes our ability to plan, to organize and strategize. And when things go wrong, like when you're solving a problem and you can't solve it, going back and correcting the strategy to find new solutions. So executive functioning is very much central, again, to the kind of tasks that are asked from a child at formal schooling. Diagnosis is never an endpoint for any individual with a developmental disability and his or her family. If a child is diagnosed with FASD, there are intervention programs that can help these children. Yes?
Does FASD have any physical?
Yes, they do also have. But the thing is, there are different types of FASD, and not all of them are perceptually visible. So the visible characteristics might fool. Also, you could get someone who's healthy, who is not diagnosed with FASD, but has some of these characteristics, if not all. Yes?
Is there an effect of using alcohol of mother, when the mother uses alcohol? For example, it will give the same results with first trimester or second trimester?
See, we know that yes, it is important, but which one is more important is not really known very well because of all the factors that we talked about that interact with one another. The first few weeks of conception, though, it seems like the developing fetus is actually, the zygote, is less susceptible to these risks. The placenta is just forming and everything, so the back and forth between the mother and the child hasn't yet started fully. And so for that reason, the first 2 weeks are more immune, to this type of thing, which also, I mean, if you think about it, I, for example, had a friend who got married, and like all married couples, they went on honeymoon, and they went to an all-inclusive resort. Right? Ye bildiğin kadar, iç içe bildiğin kadar, alcohol included. And she got pregnant, which they wanted to have a kid. Everything is fine, but then she said, I don't really remember the honeymoon because we were drunk all the time. Right? Yes, I mean, the point of going to an all-inclusive resort is to eat and drink as much as you want. Yeah, so the doctor assured her that the first few weeks of conception, she's more immune. But then again, people who are planning to conceive should not use. People who know they're pregnant should not, because from time to time you see in magazines and newspapers, 1 glass of wine a day will do you good, 1 glass of red wine a week will not do any harm. There is no scientific proof, and there are risks. I'm not telling you that they have actually proved that 1 glass of wine will lead to FASD. They haven't. But then again, why would you take the risk? Correct? Like, you know, drink after you're done with. Yes? Özel öğrenme güçlüğü. Doğru mu duydum? Özgül öğrenme güçlüğü. Now this one has actually biological and structural functions too. So it basically is more about the fact that, so in order to burn the alcohol, digest the alcohol, both the mother's and the baby's body uses a lot of oxygen. And for that reason, while the baby is growing in the womb, less oxygen is available to use for growth. That affects the development of the brain. Whereas özgül öğrenme güçlüğü does not have to have a structural brain component to it that is as readily identified. And so, of course.
Are babies also addicted to alcohol when they are born?
They can be born addicted. Usually we know that with illegal drugs, for example, mothers who use cocaine, heroin, methadone, their babies are actually born addicted. If the mother is someone who abuses alcohol, who's addicted to alcohol, it makes sense to expect that the baby will also expect the stimulus upon birth. That is also one of the reasons when these babies are born who have been exposed to, say, illegal drugs in the womb, they are born addicted and then they need to be weaned off. So they're irritable. They cry a lot. Their cries are shrill and shorter. They're harder to soothe because their body is seeking that substance which was supplied to them during pregnancy. So a mother's fetus can actually be born addicted. Yes?
I have a relative who was smoking when she was pregnant, and then her child was, it was her second child. He had a tick to, he was like, I don't know,
He was shaking his head uncontrollably.
Yes, and like, but all the time, he
Mm-hmm.
did not stop. When he was talking, whatever he was doing, he was shaking his head,
Mm-hmm.
like, and I think it still is a problem with.
It is on, I mean, it would be irresponsible of me to say that the two are related. We can't know for sure. I mean, he might have had a neurological problem that is unrelated to smoking. Though smoking does the same thing. For the women who smoke, their babies, less oxygen is available to the babies. Oxygen is extremely important in the blood for the baby's growth. We saw in these 3 trimesters how fast and rapid the development is. The baby needs as much as they can take. As it gets lower, for example, of smoking mothers, the babies that are born to smoking mothers have lower birth weight. Low birth weight is correlated. When I say low, I mean lower than the bottom threshold, so lower than, for example, 2 kilograms. Lower birth weight has been related to learning difficulties later on, attention difficulties, and other developmental issues. And so, yes, I mean, we can't say that those two are linked, but smoking during your pregnancy is not a good idea. For the simple reason that A, the baby's getting nicotine, but also B, that the baby's getting less usable oxygen. Yes?
If a woman who is alcohol get pregnant and she stops the alcohol, but if she shows the yoksun
Withdrawal. If she displays withdrawal,
is it also harmful to the baby?
now, stress of any kind is a risk factor. It's a risk factor, for example, for miscarriage. But then in any of these situations, you have to think about the pros and cons. So we can't advise this mother to keep drinking so that she feels happier and less stressful. Because stress is less related with these structural abnormalities than alcohol. So then, yes, that woman should stop and stop as soon as possible and should not think that, well, I've already drank until my 4th month, let me keep drinking. You know, that is not the way, obviously, to go. Prenatal factors in healthy prenatal maternal factors in healthy prenatal development are, as you might expect, exercise, nutrition, lack of emotional stress, being free or having less emotional stress, age, and previous births. And so, okay, we're looking at prenatal age and prenatal birth complications. The yellow bars are mothers who are between 20 and 29 years of age. The purple bars are between 30 and 39 years. The green bars are between 40 and 49. These are mothers. And the red bars are extremely rare, I would think, 50 to 55-year-old mothers. But what it is, as you can see, women in their 20s and 30s show comparable amounts of risk when it comes to maternal preeclampsia, low birth weight, and fatal death. But when the mother goes over 40 years of age, it starts increasing, and over 50, yes, these are seen much more frequently. Preeclampsia is basically mother's blood pressure is extremely high. There's a lot of swelling, and it actually may affect mother's health and well-being adversely.
And I think there is a disease called eclampsia.
Yes.
That causes the death of the mother after the birth.
It can, yes. It can if not treated. So if identified early on with these, the ones that I was talking about, the high blood pressure and stuff, then the mother can be under controlled doctor supervision throughout the pregnancy. The pregnancy might have to be, it could be a C-section that's earlier than the natural birth. And so both the mother and the child's health is basically taken into consideration then when treating it. There are 3 stages of labor. As I told you before, I am not going to make you watch a birth video. But for those of you who who are interested, there are many videos on YouTube. And so it's actually not a short amount of time. And when we watch movies, we're made to think like the woman kind of screams 3 times and then the baby comes out. But it's a very long process. A friend of mine, after going through birth, said, I now understand why in the English language they call it labor, because it is hard work, right? And so it's 12 to 14 hours is for the dilation and effacement of the cervix, right? Yes. And then the delivery of the baby typically takes 20 to 50 minutes. And then after the baby is born, the placenta also has to be discarded from the body. Yes, but this is a very natural process. Do not be scared. I see terror in some of your faces. No terror. Yes. Okay, so once the baby is born, then we have to assess the baby's health as soon as the baby is born. And so this is called the Apgar Scale, and it's administered at 1 minute after birth and then 5 minutes after birth, and it's looking at the baby's appearance. What color is the baby, right? Because if the baby is oxygen deprived, the baby's color could be more bluish purplish, and we expect babies to actually be a little bit darker than usual in normal births, but the color should start brightening up, right? The pulse, right, nabız. The grimace, is the baby responsive to outside stimuli? Activity, is the baby active, vigorously kicking? And respiration. is the baby breathing evenly? And so we need a combined score of 7+, which indicates good health. And as I said, it is administered the 1 minute after birth and then 5 minutes after birth. And it's universally applied. There are different approaches to childbirth. One could have natural childbirth or prepared childbirth, and prepare for these through, for natural childbirth, through classes, relaxation and breathing techniques. Now there's a new profession called, I don't know if it's new actually, I think there were midwives were actually supposed to also carry this out, but there's someone called the labor coach. Have you heard of a labor coach before? There are some people who are, tell me what the labor coach is. You're shaking your head knowingly.
Someone who basically helps to teach
Mm-hmm.
to go through a labor. And actually, I believe they teach about relaxation and breathing techniques too.
They may accompany the woman
Yeah.
through the birth, yes? So when the father faints, the labor coach takes over. There are different positions for delivery. Again, when we watch movies, we usually see, especially older movies, the woman lying flat on their back. Women can lie flat on their backs, but it's actually harder to give birth that way. Yes.
It's actually squatting.
Yes. And even in hospitals, there's an incline, right? There are stirrups. And so it's not really a horizontal, like laying on the beach suntanning position. And different cultures might practice these to different extents. Now, home delivery is popular among some European countries. It's becoming also popular in the United States too. Often a certified nurse or midwife delivers the baby. Yes, so some women choose to do this so that they can protect the infant from the chemicals and bacteria that might be present in the hospital setting, and they feel safer at home, and they want, if they have other kids, for example, they may want these other children to experience birth as a normal phenomenon. Yes. No to home birth.
Waterboarding is also popular.
Yes, it is very popular. And it seems to soothe the baby. And the waterboarding can happen in hospitals too if the mother chooses to and if the hospital provides this facility. It actually relaxes the mother. It makes it easier for the mother to move also. So some women actually prefer this technique as well. Labor and delivery medications. Some form is used in more than 80% of US births. We do know that the natural births can take a little bit longer when these are used because the mother's force of push actually decreases. And some complications may result, so the use is limited. Whenever possible, they try not to use it. I know many mothers who go in thinking they're not going to take it, and they're like, no, I give up, I need it at one point in the delivery. Birth complications, anoxia is a very big one that we should know. It is oxygen deprivation during birth. It is the failure of the child to begin breathing. It happens more in breech birth. Breech birth is when the baby is upside down. As compared to the expected position. So we expect the baby to come head first, but if the baby is coming feet first, it is a harder position for the baby to wiggle out from that cervix area. And so it can happen that the umbilical cord gets actually squished, and so the baby gets less oxygen during birth. Placenta abruption might happen especially with women who are older than 40, where the placenta gets breached earlier in the birth. And so the baby might actually suffer from oxygen deprivation. At cases of blood incompatibility, we also might see that the baby experiences oxygen deprivation What are the long-term effects of anoxia? So it could be that it causes initial brain injury, and what can happen is that it causes brain injury, death of cells at the time that the baby is experiencing oxygen deprivation, but then the baby might experience another round of cell death several hours later. So it has these rippling effects on the baby's health. And so if, for example, many women go into labor thinking they're going to give natural birth, but at one point it becomes apparent that it's not happening, and the doctor says, okay, we're going to go into C-section. That is not because the doctor has a place, has somewhere to be, has tickets to the theater. It is because they are worried that the infant is going to suffer oxygen deprivation and needs to be taken out as fast as possible for his own good. Yes. To prevent secondary damage, this rippling effect, researchers use head cooling devices or pre-cooled water blankets. Because in cold water, when the baby's cooled down, cell death is also slowed down. And so they use these techniques to make sure that the baby doesn't experience this ripple effect. The greater the oxygen deprivation, the poorer children's cognitive and language skills in middle childhood. So studies have shown this correlation. So it's very important that the child does not experience this. What are preterm babies and what are small for date babies? Preterm babies are babies that are early arrivers. So they come before the expected due date. We also know them, we call them premature babies, right? They may be appropriate weight for length of pregnancy. So if a baby, for example, is born 2-3 weeks before the expected date, their physical features, their weight and height, head circumference, might be characteristic of a baby who's in the womb at that period of time. So they're not really smaller than expected for their age. Small for date babies, however, is a different story. These may be born at due date. They could also be preterm, but they're below expected weight for length of pregnancy. They often have also more serious problems. Nowadays, with the advent of imaging technology and the amount of and the quality of care that can be provided both to the fetus and the mother, we can detect babies that are growing too slow in the womb. Again, second-hand experience, I had a very good friend who was pregnant in her early 30s, whose baby wasn't growing as fast as the baby should. So they monitored her, they tried to supplement her nutrition, they gave her bed rest. She did everything that the doctors asked verbatim, but nothing seemed to be helping. And so around 7 months, they actually delivered the baby preterm because the baby had the higher chance of growing faster outside the womb than inside. He's a healthy boy now, he's 3 years old. Yes?
My mom was also experiencing the same issue when she was pregnant for my sister. Her lungs were not developed very well, so they changed her nutrition, and now she just not healthy.
Yes, and also please remember, in the course of this class, I will keep saying this is correlated, this is related. It may or may not apply to you personally, because as you know, of normal distribution, right? We know that there are individuals at the tails of that normal distribution too. So when we say this is what we expect, we're talking about the average. Always keep that in mind too. Yes. Consequence for caregiving for preterm infants. So what we need to consider is that, especially for first-time mothers and fathers, parenthood is kind of a shocking experience. You can prepare yourself all you want, you can read the books, but when the baby's in your hand and is crying, it is a different experience. Recently, a very good friend of mine who's at ODTÜ, who's a developmental psychologist, last year gave birth to a baby boy. And I asked her, I said, so, are we correct in what we're saying in developmental psychology class? And she said, we are on point with everything that we talk about the baby and the child. But I found that parenting is a whole different issue. She said, I find that stuff that I say doesn't apply, I can't make it apply, and I've known of other developmental psychologists who become parents who actually became depressed because they thought they knew it all, and then they weren't prepared for how challenging it was going to be. These are very nice challenges. It makes you grow. I'm not saying that they're not insurmountable or anything, but they still are challenges. But the thing is, why am I talking about this? Preterm infants pose additional challenges to parents because they are often more irritable, they're poor feeders, and they might be unresponsive to social interaction or to outside stimulus, or less responsive than term babies. And see, this is a bidirectional relationship between the infant and the father or the mother. Because the more, I mean, imagine you're holding a baby, the more it makes eye contact with you, the more you make eye contact with it. The more it seems to smile at you, the more you smile back, right? So it's this two-way road between the infant and the parent. And preterm infants are usually also put in an incubator where they get a little bit of a delayed tactile stimulation from the parent. And we're going to talk about how there's now new types of intervention to prevent this. And so distressed, emotionally reactive preterm infants then are especially susceptible to poor parenting. So parents might not bond as well. They may neglect more when the baby is crying. They may not know what to do. They may feel helpless. And that felt helplessness might translate into behavioral avoidance. And so it is very important that when a preterm infant is born, that infant gets medical care. But it's very important that the parents get support too. And they should be made to understand that what they're experiencing is completely normal. What are interventions for preterm infants? Well, they may be put in an isolette, and they might be using a respirator, there might be a feeding tube attached, and they may be getting intravenous medication. There's something called special infant stimulation or kangaroo care, where the infant is taken out of this isolette and put it on the mother's and the father's chest so that they can actually feel that stimulation, the warmth of the skin, and hear the heartbeat. Because that's what they were hearing inside the womb, right? It was a very loud, booming heartbeat of the mother, which kind of calms them down. And so now they are also making efforts to get the parents into intensive care and have them touch and handle their baby, because it is very important, that tactile stimulation. And parents should be given parent training, both special to taking care of preterm infants and also general knowledge about how to take care of babies. How much does heredity contribute to behavior? Well, this is basically the topic of much research. And here, researchers work with heritability estimates, which is the portion of individual differences that are attributable to genetics. Who's doing this kind of research at Bilkent? Timothea, yes. The department chair is actually doing such research. And this is usually obtained from kinship studies, and she, for that reason, is working with twins. She's working on schizophrenia, and she's looking at both the influence of the environmental factors, shared environment and non-shared environment, and genetics on twins' rates of showing schizophrenia. And so if you're interested in such topics, you might want to email her. Yes. Basically, what it is, though, is that there is no real formula to saying, like, At one point, we were more naive when we were thinking about genetics, but genetics does not determine destiny, and that is what biologists are going to tell you too. Genetics, for them to be displayed and manifested, interact with environmental variables. Two individuals who have very similar genetic makeup may or may not display the same behaviors or traits. And so this is a graph that shows 3 different children, Ben, Linda, and Ron, and how they react to stimulating, extremely unstimulating to highly enriched environments. And you show differences in the behaviors too. So this is again to demonstrate that there is no one-to-one simple relationship. It's all very dialectic, very symbiotic between environment and biology. Yes. When we look at correlation between genetic and environmental factors, we of course look at identical fraternal twins, non-twin biological siblings, and unrelated step-siblings. Nevertheless, you see the influence of genetic heritability because identical twins seem to show the highest correlation, which we would expect, right, if they're inheriting the same genes, followed by fraternal twins, non-twin biological siblings, and then, as you would expect, unrelated step-siblings. Yes. And this is a very nice graph, again from your book 3.17 from Gottlieb 2007 here. The book has taken it from there. Basically, it's showing the epigenetic framework, which is basically saying that between gene expression and behavior, between behavior and environment, there are these bidirectional relationships. That it's not a simple matter of there isn't one arrow going from here to there, but there are these multiple arrows that are two-way, because that is what we get in the manifestation of gene expression. All right. I know I didn't post it, but I will. We are going to go on to chapter 4.